This is a presentation on physician-assisted suicide by Kelsey, Amanda, Elizabeth, Seth, and Samantha.
The American Medical Association defines physician-assisted suicide as being when a physician facilitates a patient's death by providing the necessary means and/or information to enable the patient to perform the life-ending act. 79% of people who use aid in dying have malignant tumors, 7% have ALS, 5% have chronic respiratory disease, 2% have heart disease, 1% has AIDS, and 6% have other illnesses. And tragically, some of these patients endure extreme pain from their terminal illnesses, which rob them of who they are. In these instances, some people come to decide that choosing a peaceful death is in their favor. But this gets a little tricky when you add in state laws, family, and the physician's role and oath. To be eligible for physician-assisted suicide, requirements include being 18 years or older, being capable of making and communicating healthcare decisions, suffering from a terminal illness leading to death within 6 months, and the patient must wait 15 days after the request before getting the prescription. Currently, patients can get aid in dying in 5 states, which are Oregon, Washington, Vermont, Montana, and New Mexico. One of the biggest reasons people support death with dignity laws is that these laws allow terminally ill patients to die on their own terms. They give patients the choice to use aid in dying if their suffering becomes unbearable. Some people also say that states that don't authorize aid in dying have unclear and unenforceable laws, so there could be underground practices that don't have any safeguards for their patients, whereas states that have enforceable laws have authorized practices and they provide safeguards such as mandatory reporting and state oversight. And the practice of aid in dying does not replace end-of-life care. Patients still have the choice of dying in their own homes and receiving hospice or palliative care as an alternative to acute hospital care. Lastly, ending the dying process by withdrawing from life support for terminally ill patients is a routine practice in which patients may not be consulted if they are unconscious, whereas aid in dying provides patients with autonomy and allows them to avoid life support that would extend their dying process but not their quality of life. Opponents to physician-assisted suicide argue that patients might be pressured to take their own lives if they feel like an emotional or financial burden to their families. Another argument against this practice is that once the pills are available, anyone can administer them because it isn't required to have a healthcare provider present. And because aid in dying is less expensive than end-of-life care, its availability could affect the patient's decision-making. Lastly, one of the big arguments against physician-assisted suicide is it's really difficult to predict when a sick patient is going to die or if they would ever eventually get better.
So here we have listed 7 of the core medical ethical principles, which include autonomy, beneficence, non-maleficence, veracity, confidentiality, justice, and fidelity. So the medical ethical principles when considering physician-assisted suicide are autonomy, beneficence, or non-maleficence. Autonomy is the agreement to respect another's rights to self-determine a course of action, or the right to choose or refuse medical therapies. There are 2 conditions that are considered necessary for autonomous acts. Liberty, which is freedom from controlling influences, and agency, the capacity to act intentionally. Advocates for physician-assisted suicide contend that individuals should be able to make judgments about the quality of their present and future life and decide their own course of action. Proponents assert that the right to request and receive aid in dying does not outweigh other moral principles such as respect for human dignity and reverence for life. So, for example, slavery is unlawful even if a person agrees to be enslaved by another. Slavery is immoral because no one should have that much power over another human. That just kind of the metaphor that they use with that, comparing that with autonomy. Beneficence is the duty to contribute positively to a patient's welfare, showing compassion, desire to do good, and it's a core principle of patient advocacy. Proponents of assisted death maintain that assisting suffering patients to die after aggressive attempts to manage psycho-spiritual distress and physical symptoms fail, that it is a compassionate response to medical failure. Those who oppose physician-assisted suicide maintain that assisting a patient to die could never be a beneficent action, and it violates the basic idea that life is sacred and should never be ended by a direct human act, even if it's to relieve suffering. Looking at non-maleficence, the definition of that is avoidance of harm or hurt, or duty to not inflict harm on others, and it's a core medical oath and part of nursing ethics. So the American Nursing Association states that participation in physician-assisted suicide violates the code for nurses and goes against the profession's covenant with society, which is grounded in Hippocratic tradition. The American Nurses Association and the American Medical Association both insist that assistance in dying is incompatible with professional role and integrity. Advocates for the physician-assisted suicide contend that to refuse assistance in dying abandons patients at the greatest time of need. So those are some things to consider when looking at these ethical principles and those who are for and against physician-assisted suicide.
Although the main outcome for patients regarding physician-assisted suicide is death, there are many other factors to consider. Physician-assisted suicide allows patients who are terminally ill to die in a painless manner, therefore avoiding additional pain and suffering that infringes on their ability to live their lives the way they want to. This choice also allows the patient to express autonomy over their health care while maintaining their dignity if they feel it may be lost in the process of natural death. Aside from the patient, it also allows family and friends the ability to say goodbye if they want to. On the other hand, many people worry that the outcome for patients facing this decision is a result of abuse or guilt. Some feel that the patient will either be persuaded to or even feel obligated to choose physician-assisted suicide in order to avoid racking up additional medical bills. Some people believe that patients at this stage of their lives may have an altered state of mind that may make them incapable of making this decision on their own. There are several potential outcomes for the healthcare system as a whole when considering the option of physician-assisted suicide. One outcome would be more availability in facilities for other patients who require medical attention. When discussing with healthcare staff, it could reduce the number of patients healthcare workers are providing for. This could make providers, nurses, and other healthcare workers more available and accessible to their individual patients, which will allow them the ability to spend more time with their patients who are also in need of medical care. As far as healthcare costs are concerned, researchers have estimated that patients who choose suicide would, on average, forgo 4 weeks of life. Medical bills for the last 4 weeks of life for those who die naturally are just over $10,000, and this would add up to $627 million annually. This amount would account for only less than 0.07% of the total healthcare costs in the U.S., although it would account for a very small portion of total healthcare costs. This can add up a lot over a lifetime.
Physician-assisted suicide carries a wide variety of spiritual and theological implications. Depending on a person's religion or spirituality, the implications may be different. In many religions, people believe that God gives us life and therefore only God alone should be able to take it away. Some question if this is a blatant rejection of God's love and His loving plan for us. Some believe suicide to be a violation of His 10 Commandments, even when it's done by a physician. Human life is thought to be sacred in many religions, so suicide by any means is not a possibility. Many people live under the principle that God never gives us more than we can handle, so if someone is going through pain and suffering, it is never more than that one person can handle. The Death with Dignity National Center has listed various religious stances on physician-assisted suicide. In Catholicism, the official position of the Catholic Church in Rome remains that killing of a human being, even to eliminate suffering, violates divine law and offends the human dignity of the person. The Eastern Orthodox stance on the issue is that physician-assisted suicide is morally and theologically impermissible because of God's sovereignty and sanctity of human life. The Evangelical Lutheran Church of America believes that destroying life created in the image of God opposes Christian conscience. They do, however, recognize that healthcare professionals struggle to choose the lesser of two evils in ambiguous, borderline situations, such as when pain becomes so unmanageable that life is indistinguishable from torture. The ELCA Church does not support legalization of physician-assisted suicide because they believe public control would be very difficult and the potential for abuse in vulnerable populations would greatly increase. The Mormon religion says physician-assisted suicide is condemned and anyone that takes part in it has violated the commandments. They believe that when dying is imminent, death should be looked at as a blessing and is a purposeful part of eternal existence. The Muslim faith also does not support physician-assisted suicide. They believe that all human life is sacred because it is given by Allah and that Allah chooses how long each person will live, and human beings should not interfere with this. On the other side of the spectrum, some people believe that physician-assisted suicide can be acceptable depending on the situation. Buddhists believe that the way life ends has a profound impact on the way new life will begin. So a person's state of mind at the time of death is very important. Their thoughts should be selfless and enlightened, free of anger, hate, or fear. This suggests that suicide is only approved for people who have achieved enlightenment and that the rest of us should avoid it. Methodists generally accept the individual's freedom of conscience to determine the means and timing of death. The legalization of physician-assisted suicide is on a church-to-church basis in the Methodist religion, as not all of them believe it should be legalized. Unitarian Universalists believe in the right to self-determination, which includes the choice to speed up their dying process. They support immunity from prosecution for those who, with the proper safeguards, honor the requests of terminally ill patients. The United Church of Christ affirms individual freedom and responsibility. It is not asserted that speeding up the dying process is the Christian position, but that their right to choose is a legitimate Christian decision. There are many different beliefs and stances on physician-assisted suicide. Even within the same religion or belief system, people can have differing stances on this matter. It comes down to how the individual person believes physician-assisted suicide will affect their life and the implications it will have on their life from a spiritual standpoint. The person that is making this choice is the only one who can determine what these implications will be for them and can make a choice based on that.
Nursing practice will greatly be impacted if physician-assisted suicide becomes legalized across the entire United States. Nurses are already being faced with more challenging and difficult ethical dilemmas than ever before. Nurses are at the forefront of a patient's care because they are the ones at the bedside 24/7, providing care to the patient and the family. If by 2020 this practice becomes legalized across every state, nurses will have to start recognizing their new role in physician-assisted suicide and check their legal position on it. Education will be the most important aspect of the nursing practice, so that nurses are educated on the legal and ethical implications of the new law. This topic will need to be added to the education curriculum. It will be very important that the nurse discusses this practice with their employer upon becoming hired at a new job. Since it is a very big ethical challenge, knowing where one stands with their beliefs must be acknowledged to the employer so they are never stuck in a situation where they feel uncomfortable. If more and more patients start choosing physician-assisted suicides, nurses will more than likely be the first ones to know about it from them. They will be put in a tough position with this ethical conflict. If it allows to proceed, nurses will no longer have to feel vulnerable when the request is asked. Therefore, decisions to personally be involved will be the only issue. This topic is highly controversial and needs to be fully evaluated before any decisions on widespread legalization can occur.